Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, and welcome to this edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me again is Dr. Felicia Beltman, who's an audiologist at Monument Health Spearfish Clinic. God, all the years I've been talking on the radio, I come to audiologist, and that's the one that trips me up. Dr. Beltman, we never really talked about kind of your background, where you're from. You are 100% local.
Yeah, I'm born and raised in Rapid City. Went to Stevens High School, and then went off to Morningside College in Iowa, in Sioux City, Iowa, and then went to graduate school at the University of South Dakota in Vermilion.
Did they specialize in this? Is this the college that you went to, or is that just where you got started and then? Nope,
that's just where I did my undergrad. Okay. There, right on the border there, practically in South Dakota.
Yeah, you never really left.
You're right. No, I went there. Played soccer. And
oh, did you really?
Yeah.
Oh, awesome.
And got a degree in biology, and then went to the University of South Dakota there.
Okay.
Again, just across the border there in Vermilion for audiology school.
Well, I'm assuming while you played soccer, you wore plenty of ear protection then, correct?
Not ear protection, no.
Well, anyway, let's talk about hearing aids and cochlear implants. You had told me that almost all hearing loss can be fixed, can be corrected, or at least give a semblance of what it used to be for these people. And I thought that was pretty amazing, because I believe with vision, there are some instances where you may never be able to see again when you lose your vision. But hearing, at least, it gives you that hope that even if something's damaged, you'll be able to fix it. And we were also talking a little bit about a lot of videos that you see when people get their cochlear implants turned on, and how emotional it is in a lot of instances. And boy, did you enlighten me as to why that is a good thing, and maybe not so good for some people as well. So I think if we talk about this, and this is something people are considering getting done, they'll have all the information. So obviously there are different types of hearing loss, right?
Correct.
What would be some of them?
So there are different types of hearing loss, meaning sensory neural hearing loss, conductive hearing loss, or you can have a mixed hearing loss, which is a combination of those first two.
What's the sensory then?
So the sensory neural hearing loss is it was a damage in the cochlea, which can happen from age, noise, genetics, and then it can also have damage in through the nerve.
Okay.
And then that is a permanent hearing loss. That is not something that we're going to be able to medically fix. Whereas a conductive hearing loss typically occurs in what they call the middle ear, and that is where sound, the outer and middle ear, I should say, that's where sound has trouble conducting through the ear. So sometimes people will be born without an ear canal, or there's just no canal there, but everything else is there. They just need to open the canal, or sometimes they can't open the canal, and then we fit a different kind of a hearing aid on that. Or you'll hear kids getting fluid in the middle ear, and that's a conductive hearing loss. If we take that out, it's fixed. So conductive hearing losses typically can be treated medically, meaning we'll refer to an ENT or an ear, nose, and throat surgeon, and they can consult there. But sometimes conductive hearing losses can't be medically treated, and then they'll come back to us for that.
So a lot of parents, I think what they're most familiar with, or that seems like to be is the most common, the tubes. Does that happen quite a bit with
That's very
with
common
kids?
for kids.
Yeah.
As far as permanent hearing loss goes, is sensory neural hearing loss.
Okay. What happen? Why do kids need the tubes in a lot of instances? What's happening there?
There's fluid behind that middle ear, and then the tube will allow the fluid to come out. ENTs can go into a lot more detail as far as that goes. We work in tandem with that to make sure that the fluid isn't causing hearing loss, and that I help. I work very closely with Dr. Jones, since he is our ENT there in Spearfish, to test kids to see kind of where they're at as far as their fluid there. Is it impacting their hearing? Things like that.
Okay, so we kind of touched a little bit then about how these are treated differently, right? So are the two main treatments for something like this a hearing aid or an implant? Are those kind of the main ways to treat it outside of surgery?
So as far as treating hearing loss, hearing aids are going to be our first option.
Okay.
They're the least invasive option. So hearing aids are taking the sound and just making it louder.
Okay.
That's what the hearing aid does. There's a lot of features to hearing aids. There's a lot of fancy features to hearing aids as far as reducing background noise, Bluetooth.
There's Bluetooth versions of hearing aids?
Almost all hearing aids now have Bluetooth in them and are rechargeable, so you don't have to put a battery in every day. And
Oh, I never even thought about, they would have had to have batteries in them.
And some of them are starting to have like AI technology where when you walk in a room, it kind of analyzes and is there sound over here? Is there noise over here? And it can shut down noise, raise speech. A lot of different features to hearing aids. They've come a long ways.
Oh, you don't want one ever, but it's like, that's kind of cool. It sounds like those would be fun to have when you go into a room.
Yeah. So when someone gets a phone call, they just answer it on their phone and it's in their hearing aids.
Oh my God.
They can listen to podcasts on their hearing aids. They've come a long way. So that's our first, and that can treat a mild hearing loss down to a severe hearing loss, but typically more mild to severe hearing losses.
Was it a big deal for you once they made hearing aids kind of over the counter? Was that a change anything for you?
Not really.
Okay.
Not really, because the over-the-counter hearing aids treat mild to moderate hearing loss.
Okay.
They require you to fit them by yourself at home, and there's just not a lot of people that have the skill set to do that
Right.
effectively, and so then the hearing aids, they either don't like them, they don't work well enough, and then they end up in our office and say, well, I tried these, but they didn't work, or I bought these for my husband, but they don't work. And then they come to us and we talk about why and different options, and once we can talk about that, they see the difference, they're blown away.
Well, that's a great point. I think a lot of people think, well, I can go in, I can get my, my Benadryl, and then I'll buy my hearing aid in the same shopping trip, thinking it'll be as easy as popping it in your ear.
Right.
And it'll work. But I don't think a lot of people realize just how much goes into making sure they fit correctly, right?
There's a lot that goes into making it work. I think of it like, just an analogy, is when you see commercials for like dental devices.
Yeah.
They'll send you this stuff, you do this, you do that, they'll send you a retainer or whatever. You can do that. You may very well mess up your whole mouth.
Well, of course.
Whereas I would prefer to go to a dentist who has the experience, who can look at my mouth and tell me, you need this or you need that, or that's not a good idea for you because of, X, Y, and Z.
Right.
That I have no knowledge in. I don't have any knowledge in dental. So I'm going to go listen to a professional. And that's how I think of it with hearing aids and hearing loss. It may seem really simple. You just pop them on and now I can hear. Are you getting enough? Are you getting enough volume? Or do you have too much? Do you have it in the right range? Are you, causing more hearing loss? Are you treating the hearing loss? Because a lot of times people with hearing loss don't know how much volume they really need. They don't really know where that line is. They have trouble assessing sound, basically.
That's probably the best public service you can take from this is, yes, you can go get your own, but oh boy, if you want these things to work, see somebody that knows
what we're doing.
Yep. Exactly.
Yeah, and so that's the first one. That's the kind of the first way to treat hearing loss is hearing aids. Once we start working with someone, we will, as we're testing, as we're working with that patient, we look at what we call their audiogram. That's a graph of where their hearing loss is. And then we look at how they functionally do with their family. How do they communicate? At some point along that journey, when we start to really see things change, we'll probably say to them, you're looking more and more like a cochlear implant candidate. Is that something you want to talk about? Is that something you want to discuss? And my goal is always just to educate. So people can make their own choices, their own decisions as patients. My job is to educate you in all the different options that you have, why someone may choose one option over another, and then let you make those choices for yourself. So I'm here to be, go alongside the patient.
I'm so amazed that a cochlear implant can actually restore hearing to somebody that's never had it. Correct?
Yes and no. So when a child has never had hearing and they're an infant, cochlear implantation can take place up to starting at 9 months.
Oh, I was going to say, okay, 9 months, perfect.
At 9 months of age.
Okay.
And that would be for a baby that has what we call profound hearing loss, meaning there is when we test, there's really no detectable hearing in the cochlea. And then, so beyond that, then you can implant a child then, very, very young. If someone has been what we call deafened for, 20, 30 years, even 10, 15 years, and they've never had hearing, they're not going to be necessarily a good candidate. Can we still implant them? Is everything still there to do the implantation? Yes. Are they going to be what we would consider successful? Are they going to have the level of success that they want? It depends. That's where you manage those expectations. And
I see.
And you have to really know what the goal is for that, because if that's the case, then at best you're probably looking just, can you hear sound? And we call that sound awareness.
Okay. So it is. So am I getting the right point from this? Is it better for a baby starting at 9 months to get it earlier?
Yep, earlier
the
better.
better, for sure.
Mm-hmm.
So,
because we want to get that sound in, and that has to do also with not just the health of the nerve and everything, the auditory nerve, but you're then looking at the speech side of things, the language side of things, and how the brain develops language, and we need to have that input in there by about 3 or 4.
So what? And maybe you did kind of touch on this a little bit, but what damage can a cochlear implant fix?
It's typically the cochlear damage.
It's just to the cochlear. That's
the cochlea.
Okay.
Yep. Yep. So there's
the terminology better than I do.
That's fine. So what we're doing is there's a little electrode that a surgeon would implant into the cochlea. That electrode then excites the nerve and sends electrical information to the nerve.
Okay.
So when you're hearing, as we're designed to hear, and as you're hearing with a hearing aid, that's acoustic sound. So you're getting acoustic sound in. With a cochlear implant, we're sending acoustic sound into the outside piece that you see. Mm-hmm. That's transmitted into electricity, and then that electricity is sent through the nerve, because that's what our nerves use to communicate.
Can you use hearing aids and implants?
Not on the same ear. So if we implant one ear, you only use a cochlear implant on that ear.
Okay.
You use a hearing aid. Then a lot of times you'll see a hearing aid on the other side, if not another cochlear implant.
So that's kind of common?
Mm-hmm, very
for
common.
For a lot of people? Oh, interesting.
And adults are different. So then adults, if you've had hearing and you have language, then if you lose that, then we can implant with good success.
Oh,
the difference is when you haven't had any stimulation to that nerve and to how the brain hears is different. So if you've had hearing, implants are fine later in life.
Right.
You've never had hearing to that ear. If nothing's ever been done to that ear, probably not a good candidate. If you're a child, and an infant or a baby, toddler, somewhere in there,
makes sense.
yes, then implantation young is fine.
Well, that gets back around to all of these videos you see online of people that have their implants turned on. And it's a big moment when you watch a lot of these videos. And some of them are pretty moving. I mean, some of them are, these people are, I don't know if they've never heard, like you said, or if they had hearing and now it's back, or watching kids. And when you watch them, you're like, wow, that's amazing science, the technology. And it's not always the case, though, right?
Not always. So I do see a lot of moving things in my clinic, and a lot of things where I'm like, wow, my job is so cool.
Right.
I get to help this person. I get to help this family. And it is amazing. But there are instances where turning that cochlear implant can be scary. It can be nerve-wracking. It can be, wow, this is too much right now. Kind of feelings, because you are introducing sound to a nerve that hasn't had sound in a long time.
And you never think about that when you're watching that, ever. So what does it sound like?
It can sound metallic. It can sound kind of screechy. But the main point is that's just the beginning. And we do a lot of counseling and a lot of sitting down and a lot of talking about this prior to. So these patients also know that what to expect, or we've talked about it in the moment. That might feel different, right? Mm-hmm. But we've had those conversations that this is day one of a long journey.
Yeah.
So those patients know that it could take 3 to 6 months, sometimes up to 9 months, to really understand speech with that cochlear implant. Now they have a hearing aid on the other side, and that hearing aid is assisting in those conversations. We have them do what's called oral rehab, which is kind of like hearing therapy.
Right.
And so I just don't want anyone to think, okay, because it's scary the first day, or there may be it may be like intimidating the first day, that's not something I want to do. That it's just day one of a very beautiful journey typically.
Right. Well, it has to be like anything. If you go for knee replacement, you got to know that
That's
next day
exactly what I tell
be,
people.
Right.
I tell people all the time. I say, if you go get a knee, that you don't pop up off the table and say, okay, I'm going to go for a run, thanks.
Right. Yeah.
You say, okay, I am going to do my therapy.
Yeah.
I'm going to take it as it comes, and really work hard at it.
Do you have people that once they're turned on and once they've gone through the process, they're like, I don't want it. It helps, sure, whatever, but maybe I was better off without things sounding
I personally
this way.
have not had that,
Really?
but I'm sure that happens. I've
Sure.
heard of that happening. I think every patient is different, and that's something you have to consider too. Is where did you start on this journey? Not everybody starts at the same place, and it's not comparing apples to apples.
Right.
Some of the biggest things we look for are how long has this hearing loss been there? How long, what they call it, duration of deafness. What caused the deafness? Was it noise? Was it a sickness? Was it something, a traumatic to, an accident or something like that? And then what is the support like? Do you have good family support? Do you have someone there to help you? Do you have someone there to remind you to do your reading and your rehab type stuff? Do you have someone to communicate with?
Yeah.
Because
obviously.
if you're sitting in quiet with your cochlear implant on, it's hard to really practice. You need someone to talk to. You need to have conversations. How social are you? So there's a lot of factors to it, and that's obviously something we go through in the clinic. But no, I think those videos are fun. I think sometimes it can be like that. I've had hearing aids too. The hearing aid ones are probably more immediate.
Right.
But no, they're fun. They're beautiful. You have those special moments. But sometimes even I'm watching them and I'm like, that can't be her. That can't be her first time.
Right.
Or that might, that could be. There's probably more to that story there.
Right. Can you turn off the implants?
You just take it off.
You just take it off.
Just take it off.
I see. In that social situation, you're like, I'm just tired of listening to you. Take it off. Put it in the pocket.
Absolutely. I have a cousin who wears 2 cochlear implants, and she has been known to pop them off.
What got you into this? Why did this become a field for you?
Well, like most audiologists, you thought you were going to be a speech-language pathologist, and then the undergraduate courses are the same.
Okay.
And so my cousin was born deaf, and so I was around her, and I've been around hearing loss and, her deafness, her cochlear, she has cochlear implants, and at one point had hearing aids. And so I've been around that my whole life.
Okay.
And then I would be there sometimes when her speech language pathologist would come to the house when she was really little. And I was like, that is cool. And so as I got older, I was like, that would be a cool job. And so I went to originally go to school for that, and then I got into audiology, and I was like, no, I think this is where I want to be. And so that's how I ended up in audiology.
Okay. In the future, what do you see as far as technology goes, as far as, because everything seems like every 2 years, it seems like something brand new has popped up in fields like this. Do you see anything exciting in the horizon that might change the way we use implants or hearing aids? Or is this or is there any other way really to fix this outside of those devices?
I know there's always different research going on with the hair cells of the inner ear are really the problem.
Right.
They're what goes bad.
Because once they're gone, right?
Right.
They don't come back.
There's no yeah. And so right now there's research on that. Do I think we're close to that? No.
Really?
But I think people are always going to be exploring that option.
Yeah.
As far as technologies go, hearing aids they're just going to continue to advance as everything advances. So getting smaller, things are rechargeable right now, but the battery life will continue to get better, I think.
Right.
The technology in them as far as the noise suppression, background noise is going to be everyone's with a hearing aid's number one issue, number one problem, understandably. And so those features are just going to continue to get better. The comfort, having something
that's
on
got
the
to be
ear.
a big one too. Sure.
Yeah, and so I think that's kind of where we're going. And cochlear implants will just follow that same line, the rechargeability, the technology, the noise suppression, the sound. Because hearing aids and cochlear implants yes, they give you hearing back, but it's never your normal natural hearing.
Right.
And that's not necessarily an expectation that we give. And so I think that, too, is somewhere where technology is going, is just getting it to be more and more natural sounding.
Excellent. Well, Dr. Felicia Beltman, thank you very much for coming in and talking.
Oh, I could talk about ears and hearing all day long. So.
Well, like I said, I went down some rabbit holes just watching videos of this, and what's inside your ear is unbelievably fascinating just for how it connects to so much else in your body. And nobody really gives that a second thought.
No, we always talk about hearing being quality of life. So if you can't hear, you can't communicate. That it severely impacts your quality of life. And we didn't really talk much about adult hearing loss, but that is one of the factors for cognitive decline is isolation.
Oh, of course,
it's not that hearing loss causes dementia or causes cognitive decline. It's that you're isolated because you went to church or you went to a social event and you didn't hear, or you heard wrong and everyone kind of laughed or was like, what are you talking about? And that was embarrassing, and you're not going back. So now you've quit going out, you stay home, you don't socialize, and now that cognitive decline can set in because you're so isolated. And so if we can keep you hearing, if we can keep you in conversation, if we can keep you out and about in your community, still wanting to volunteer, still wanting to be part of that, that's going to be huge for your overall health, not just for your hearing, but for your mental health, for your physical health.
I keep hearing every time I go to my parents' house when I'm talking to my dad or making conversation. He's 81, my mom's 81. And my mom will say, he didn't hear a word you said because he turned his hearing aids off. And she says, I know he does that on purpose. So maybe for some people, it's not the isolation. It's just want things to be quiet for a minute.
Yep.
Anyway, again, anytime you want to come back, doctor, and talk about this, there's so many other interesting things just on the inside of your ear that I didn't think was as fascinating as it was, and you made it a lot of fun, so I appreciate it.
Good, I'm glad.
Dr. Felicia Beltman is a doctor of audiology at Monument Health at the Spearfish Clinic. Thank you very much for coming in and talking.
Thank you.
You bet.